Hi everyone, my name is Kim and I chose option 1, joint movements. First up we have flexion, which is a movement that decreases a joint angle, and extension straightens a joint, returns a body part to the zero position. The zero position just refers to when someone is standing in anatomical position. So joint movements can be described as deviating from the zero position or returning to it. First up, we have flexion. So bending the elbow so the arm and forearm go from a 180-degree angle to a 90. Flexion. Extension is when you're straightening a joint. So going back to the zero position, back to 180, straightening out the arm here. Flexion in to 90-degree angle or less. Extension out to zero position, flat 180. Next up we have abduction and adduction, number 3 and 4. Abduction is away from the midline, adduction toward the midline. I remember adduction with ADD, add, meaning you're adding something, and add toward. So abduction, we have the movement of a body part in the frontal plane away from the midline. Up. And then adduction is the movement in the frontal plane back toward the midline. Down. Abduction. Adduction. Ab is going away from the midline. Abduction back towards the midline. All right, moving on to number 5 and 6, we have elevation, which is a movement that raises your body part vertically in the frontal plane. And depression is when it lowers a body part in the same plane. And for this, I will be demonstrating elevation of the shoulders and depression of the shoulders. Okay, so next I'm going to show you elevation and depression. I'm going to turn around and show my shoulders going up, like shrugging my shoulders, and then down, depression. One moment. Okay, so elevation, raising the body part vertically. Depression, lowering that same body part. Elevation, depression, shrugging the shoulders. Next up, we have protraction and retraction. Protraction, anterior movement of a body part in the transverse, that's the horizontal plane. And then retraction is posterior movement of a body part in the horizontal plane. And I'm going to demonstrate pushing something in front of me open, or pushing something away, and pulling back, returning to the zero position. Okay, so I apologize. I don't have anyone to film me, so I'm doing this on my own. Okay, so protraction. My shoulders, I'm going to push in front of me, like push open something, push against something. My shoulders are moving out. Retraction is when it's pulling the shoulders back. Next up, we have circumduction. So that is when one end of an appendage remains stationary and the other makes a circular motion. So I'm going to keep my shoulders still and then make a circle with my hands. So my shoulders staying still, my hand is moving in little circular motions. Okay, so shoulder is stationary, it's not going to move. I'm just moving my hand. Shoulder stationary, hand moving, circumduction. These are little circles if you can't tell. Okay, so rotation, elbow bent, going in and then back out. In is medial rotation, medial internal rotation. Back out, external or lateral. Lateral external rotation. Medial internal rotation, back out, external. All right, we're getting there, I promise. 2 more here. Supination and pronation. These are mostly movements primarily forearm movements. So supination is when you're turning your palm anteriorly or upward. Pronation, you're doing the opposite of supination. You're turning your palm downward. Okay, so let's assume I'm standing in anatomical position. Face forward, feet flat, arms at my sides, palms upward. This is supination. And turning it palm downward, pronation. Supination, pronation. Okay, here we go to last 2. Dorsiflexion. So dorsiflexion and plantar flexion are both special to the foot. Dorsiflexion is when you have your toes elevated, and plantar flexion is when your toes point downward. Okay, dorsiflexion. Apologize, I don't have a pedicure. Toes elevated. Pretend this is at rest. Some flat, elevated toes, like you're trimming your toenails. 0 position. And then opposite, plantar flexion. Toes are going to point downward. 0 position. And then up. Dorsiflexion. Toes elevated. 0 position. Plantar downward. All right, guys, that's all I have for the joint movements. I hope I helped you somewhat. I certainly will remember. Actually, doing these movements helps me memorize, and that's good. So thanks. Bye.